Okay, my name is Philip Di Melo, and today is my introductory lecture for you, for nurses. And thank you very much for inviting me to give this lecture. I would like to tell you that when I speak with nurses about nursing informatics, they always complain. They say, "Oh gosh, we're so afraid of this course, and because there are formulas, mathematics, and all kind of theorems that we have to remember, and it's so difficult, so hard." And today I would like to tell you that actually there are many problemms in nursing informatics, in healthcare and public health, which are not difficult at all. They look like very difficult, but they are easy. And I can show you today two examples, but they are infinite number of examples, that you can solve this problem without very minimum knowledge. Okay, so you don't need to know very complex theorems in statistics and so forth in a very simple way, but you will be able to solve many problems in your work. So first of all, I would like to say, so suppose you have two medications, one, this one, and two. You know that medication, they have KPI. So they pass clinical trials and we know quite well, and the developers know quite well where this work, what side effects, and so forth, and they assign a value to the medication. And suppose the first performance indicator, performance value, is 0.7 for this medication and 0.6 for this medication. So the question is what will be the performance if a patient takes two medications concurrently? Will it be less? Maybe one medication and second medication would not give you much increase in improvement, or maybe deterioration or decrease this value performance. So this is a very practical problem that we can solve in a very easy way. So I repeat again. So we have performance indicator for one medication. For the first one is 0.7. For the second is 0.6. They are almost the same. And what's the performance of two medication if you take concurrently? Will it change or something? Now let's solve it. So first of all, I will just remind you, what does it mean probability? Because P1 actually can think of performance as a probability that it has positive, sizable, significant impact. Okay, so that is probability of 0.7. And when you evaluate the performance indicators, so you are actually thinking about probabilities. So when it has impact, how can impact the health and how the treatment of a patient. So suppose you have a die and you want to see 6. You just toss it, you want to see 6. Okay, so you have 6 probability to have 6. We call this A, this event, which is 6. You want to see 6. How many 6 on a die? Just one, right? 6, 1. So favorable is only one. But there are 6 other possibilities. It is 1, 2, 3, 4, 5, 6. So there's a probability to have 6 on a die when you toss it. All right. Then we also have P A bar. What is PA bar? PA bar means that what the probability that when you toss the die, it won't show 6. It can be 1, can be 2, can be 3, can be 4, can be 5, but no 6. How many these possibilities? 5, right? 5. But the total case number of all possibilities is 6. So then there is a theorem we call it this full probability theorem, shows that P A plus P A bar always equals 1. This is one thing that we should remember, and we needed to solve this problem with medications. Another one, suppose I have two events, A and B. So the first event is that Philip de Melo gives a lecture to nurses. And B is a sun in California, let's say. So these two events are independent. I can give lecture when it's sun in California or there is no sun in California, right? So the probability of this event, joint event, right? This one, probability, they are independent, equals probability of giving a lecture, A, and probability of sun in California. This is another theorem that we are going to use, and that's it. There are no more formulas, I promise you, to be shown. It's that what we need. It's very simple. So don't be frightened, don't be afraid of mathematics. That's only two things what we need. Now, let's do this. So first of all, we have to find out the event. We need always describe the event. The event A, I remember, I try to remind you that it is performance of taking two medications concurrently. So I put this 2. This is our event. What the probability, what the impact will be on the patient if he or she takes two medications. So first we need to put this one, probability P1, times probability P2 with bar here. So what does it mean, this P1 times P2 bar? This is that because we calculate the positive impact, so at least one medication will work. So P1 will work, but P2 doesn't work. So there are patients that P1 works, and P2 doesn't work, okay? Now, the second one will be that P1 doesn't work because performance is not 100%. It is 0.7, so sometimes it doesn't work. So P1 multiply by P2. So what does it mean? P1 doesn't work, this medication doesn't show effect, but P2 works, so we have at least one works, okay? Then we have another possibility that both work, so we're also happy with that. P1, P2. Now, we should calculate the probability of that. That will be P1 equals 0.7 times P2 bar. P2 bar is 0.4 because P2 bar from this formula, 1 minus PA. So PA bar will be 1 minus 0.6 will be 0.4. 0.4 plus P1 bar. So when medication P1 doesn't work, it will be 0.3, right? Because 1 minus 0.7, we use this formula. 1 minus when it works, we have 0.3 when it doesn't work. Times P2, 0.6. Plus here, P1, P2 will be 0.7. So it is 7.7 times let's put 7 better, 0.6. That's it. So what it will be here, So 7.7.4, I will put right away in percentage. I have to multiply by 100. It is so simple. You don't need to use your calculators. I know that some you come with my lecture with calculator. You don't need calculators here. 7 times 4 is 28, so 28%. 28, I'm sorry. And this will be times 100 will be 2 point, I'm sorry, it will be 28%. I'm sorry, 28%. 28%, no decimals. Now, 3 times 6, it will be 18%. And 7.7.6 will be 42%. Oh, I'm sorry, this is 18. I put 14, 18, I'm sorry. Plus 42. And this will give you 88%. So when you use two medications concurrently, right, with 1.7 kpi, another with 0.6, you actually improves the impact of these medications, and now you have 88%. That's what it is. It's very simple. What can be easier than that? Nothing. So please do not be afraid. It is very simple things. Now, another problem that sounds very complex, and I will show you that we can solve it also in very easy way. So suppose you have just a second, a hospital, and you know that we have about 6,000 hospitals in our country. In the United States, we have about 6,000 hospitals, and each hospital, they have some statistics, okay? And they're very much interested because if they don't have statistics, they don't know, they cannot develop strategy and policy, how to work with patients. Now, we have, this hospital has 50% of patients who come to ER with symptoms of flu, 50%, 20% with high blood pressure, and 30% other. It can be neurological conditions, somebody fell off bicycles, and who knows what can be. So this 30%. What is interesting is that 3% of flu patients with flu symptoms are hospitalized. That's what of interest to any hospital. But 10% with BP are hospitalized, can be symptoms of stroke or something like that. So they are 10% hospitalized, and 8% with other diseases or some other symptoms, whatever, hospitalized. So what is the probability that a new patient who comes to ER, to emergency room, will be hospitalized? That is what every hospital wants to know, what the probability would be that this person will be hospitalized, because they have to prepare. They have to prepare staff, they have to prepare rooms, they have to prepare everything. This looks so difficult problem. And I spoke with my colleague who works in a hospital. He's doing some computer work on data entry and so forth. So he said that this is too complicated problem. It is complex, so they do some averages and so forth. I will show you now that this problem we will solve in 1 minute, not more. It is 1 minute, or maybe just because I'm writing slow, 2 minutes, but it can be solved in 1 minute. So what we have to do first, we have to draw a circle. So suppose this here, circle. Not circle, I'm sorry. a square or rectangular like this, doesn't matter. So what happens is that 50% of they have flu. So I put here F, flu patient. That I'm just repeat again what it is written, but I just put it in the drawing. 20% high BP. So 20%, I can put some, okay, something like here. It is BP, blood pressure. So this is 0.5, 50%. This is 0.2. This is BP. And this one, 30% at 0.3. they have other. I put O here, other diseases. Now, what I have to do is to use this one information we used. So now we have to use this information. So 3% of flu patients hospitalized. So I have to put here 3%. It is not, has to be horizontal line, but I'm putting everything using hand and subtitles. So this is 3%. I will just put here some color. So it is 3% hospitalized. 3%. When a person comes with BP, it is 10% hospitalization. And other is 8%. So it is 8%, and this is 10%. So this is 10% on vertical line. This is 8%, and this is 3%. So what we need to know to calculate that a person who comes to ER falls in this category. It can be here, it can be here, it can be here. In both, in three categories, it will be hospitalized. He will be hospitalized, she will be hospitalized, right? So what is the area of these rectangulars? It's very easy to calculate the area of rectangulars. Okay, I will just put it here, for example. Here, the area of rectangular, this one, is 0.5 times 3%, it is 0.3. So we finish with this. Now this one, it is 0.2. Times 10%, which is 0.1. Plus this area would be 0.3 times 8%. 8% will be 0.08. Okay, finish. There is nothing to do. We need only just to calculate. You can take your calculators if you want, but you can do it in just very easy. We don't need to do some calculation because it's very easy to calculate. And I recommend also you multiply by 100 right away, so you have in percentage. So the probability that person comes to ER and will be hospitalized equals this one will give you 1.5%. Yeah, it is half of 3%. Is 1.5%. This guy will give you probability 2%. So it is 0.2, which is 2%. And when you multiply this and multiply by 100, okay, then you will have 2.4%. Now we need just to add equals 1.5. Just put better point dot here. 1.5 plus 2, it is 3.5. And 2 plus 4, it will be 5.9%. So actually, this problem that looks terribly difficult, we solve it in one sentence. This is an exact result of this problem. Of course, many problems of nursing informatics are different from here, and we can maybe discuss if you invite me to come next time. We can discuss other problems of nursing informatics. But this, I repeat again that this is introductory lecture. I showed you that you should not be afraid. Many problems of nursing informatics and actually in informatics technology in general can be solved in an easy way. Okay, thank you for your attention, and I will see probably you next time. Bye-bye.